Hi, I'm Bet Mishra. I'm the clinical tutor at Maidstone Hospital and I'm also the Foundation Training Programme Director here. I look after the general training of our Foundation F1 and F2 years. That involves making sure that they're in the correct placements, that they have a smooth integration when they arrive here. They're obviously quite nervous, but we hope we have a very friendly atmosphere here, and you're always supported by the next tier up as well as by your consultants. So we do try very hard to make sure you have a good experience. That's not to say it doesn't get difficult at times. We're going through difficult times in the NHS as a whole, so there are times when there is a lot to do. However, I hope that you get the support you need during your year with us. We have good programmes involving different specialties, so you get a wide exposure to different forms of medicine such as psychiatry, surgery, general medicine. There's quite a lot of general medicine on the Maidstone site. Those of you who do surgery will swap between this and our other site at Pembury Hospital. We have an integrated programme for our surgical trainees between the two sites, which I think works quite well. We have about 25 or so trainees every year, and that's in each year group. And we would also aim to make sure they have quite a lot of teaching in our postgraduate centre. So as well as the on-the-ward training that they get, they would be expected to attend a couple of sessions of formal training for each year group again in the postgraduate centre. The training programme for that is set up by one of our more senior trainees, and we try and encompass all aspects of the curriculum, and anything that the last year group may think has been missed out, we try and include in the next year group. That may of course include things that are not so exciting, such as mandatory items, but we also try and cover most of the medicine they need to learn on the way through, with lots of talks by senior consultants too, which has always gone down very well here. We have a very active academic centre. You'll be supported both by myself and also our academic managers here. But in honesty, I think the most support you get is from each other. And I find that the mess here runs very well. There's a very supportive and engaging group of people who try and keep the mess very active. We also have a good teaching programme here, as well as the formal training for the foundation years. We have a grand round once a week, which is really well attended. Most of the physicians and the junior doctors try and get to that. And we have sandwiches just before, which is handy. And we again try and cover quite a large range of medicine. Not just general medicine, but also surgery, pathology and other specialties. I think the grand round is particularly good here at Maidstone. I think a lot of hospitals have had trouble keeping the grand round going, but we have managed to do so far. So the academic centres, we're very lucky. Both sites have actually got very modern, recently put together academic centres. We have a large auditorium on the Maidstone site which can house 150 people, and in that lots of programmes go on, including your training programmes, but also much more wide-ranging things. Several consultants run teaching courses through the year. We have an extremely good simulation centre. Again, on both sites we have high levels of simulation training and really excellent audiovisual facilities. There are times when you may be on the other site to the one that you started on, and there's a shuttle bus that runs very regularly between the two sites, so that's very straightforward. The Maidstone site also houses the Kent Oncology Centre, which provides tertiary level oncology services for the whole county. We have many consultant oncologists who work between us and the other hospitals in the area, so we have extremely high levels of care. Although the F1 doctors won't be involved directly in that, of course just being in a hospital with such a high level cancer care centre does mean that the way we practice changes a bit. We also have, partly because of the cancer services here, really good imaging services here. We have MRI scanning and CT scanning, again at very high levels, and excellent radiologists who take part in MDTs. I hope that you will be exposed to all these MDTs on your way through. Even if you don't belong to the firm, we would encourage you to try and go to some of these just to get an idea, a feel for what goes on at these complex meetings. Although it does sometimes feel like we are a small hospital attached to a very large cancer centre, the rest of the hospital also has really excellent facilities. We have a fully fledged cardiac unit that does highly invasive cardiology procedures. We also have excellent gastro and respiratory centres. We do understand that starting in your F1 year can feel like you've just been dropped off the edge of a cliff. I think we provide a really supportive environment. So you can come to me, you can talk to me if you'd like to, but of course sometimes the problems you have can be more easily discussed or solved by talking to one of our academic staff teams.
My name is James Ironside. I am the clinical tutor at Tunbridge Wells Hospital. The role of clinical tutor means that I am the foundation training program director, so I oversee the program for new foundation doctors as they transition from being medical students into their first experience as a hospital doctor. The transition from medical student to doctor is a difficult step to take, and our aim at the hospital is to ensure that the transition occurs as smoothly and seamlessly as possible, and also to ensure that all new foundation doctors are fully supported when they first start with us. We have around 30 Foundation Year 1 doctors with us each year in Tunbridge Wells Hospital, who are from a variety of backgrounds and often a significant number of different medical schools around the country, and sometimes from international medical schools. Our overriding aim is to provide a supportive environment for the first year foundation doctors as they rotate through at the hospital, and to ensure that throughout that year that everyone is supported as much as possible to complete all of the curriculum requirements they need to be able to be signed off with a successful outcome at the end of their first year. Foundation Year 1 doctors rotate through the hospital in 4-month blocks. Most people will go through blocks in surgery or surgical specialties and medicine and medical specialties, and also into 1 or 2 other subspecialties including psychiatry. Having worked here for many years, I think it is entirely fair to say that this is a very friendly and supportive hospital. We ask a small number of the F1 doctors to be the representatives for all of you across the year, and those representatives are people who will aim to gain feedback from all of you in order to be able to bring forward any issues or problems or complications that you have so that these can be addressed. But also that if there are suggestions for improvement or positive feedback, that's always something that is very welcome and is fed back to the relevant people. What do we ask of F1 doctors? Well, principally that they are honest and open with us, so that if there are issues that people are struggling with, we hope that these can be brought to our attention, and a variety of ways in which these can be supported and helped is available to everyone in their first year. It's fair to say that 2020 and 2021 have been immensely challenging years because largely of the unprecedented situation that we've experienced due to COVID. During this time, a number of adaptations have been needed to be introduced. We strongly hope that many of the curtailments on being able to meet socially and being able to be present in rooms face-to-face for teaching are issues that will diminish over time in 2021, and that going forward after that, that many of those very challenging situations that we've had to face will be things of the past. The challenges that COVID has brought have been widespread and well known, but throughout the hospital we have been immensely impressed and grateful for all of the additional efforts that the foundation doctors have gone to try and support patient safety and to support the work of the hospital, and in return we have done everything we can to try to make sure that people are supported and are safe during that time. Tunbridge Wells Hospital is a modern hospital that opened for the first time in 2011. It is a district general hospital that is largely single side room populated and functions as a trauma unit. as well as encompassing all the major specialties within the hospital, particularly surgery and surgical specialties, general medicine, paediatrics, obstetrics and gynecology, as well as a trauma unit emergency department. The Education Centre and the staff who work there are immensely supportive and are always willing to go the extra mile to be helpful to any of the juniors who need support. There is an extensive teaching programme for Foundation Year 1 doctors, and this is ably supported by our dedicated education fellows as well as the staff who work in the education department. This includes a variety of ways in which the teaching is delivered, including face-to-face and online teaching, and a very active simulation department, which includes simulation in a multi-professional and multidisciplinary fashion. Tunbridge Wells Hospital has a reputation for excellence, but beyond that, it is one of the most friendly and supportive environments in which I believe a junior doctor could start their medical career, and we look forward to welcoming you.
Hi, my name's Anita. I'm the Academic Centre Manager here at Maidstone Hospital, and I'm here to support you as a foundation trainee anytime you need for any queries or any questions you have. We have excellent facilities at the Academic Centre. We have a great library, skills labs and laparoscopic suites for you to utilise. Teaching in Maidstone Hospital for F1s is on a Tuesday and Thursday, and for F2s is on a Thursday afternoon. All our teaching is consultant led, and we do have excellent teaching programmes in place. Everyone in the medical education team is very approachable and positive, and we have an open door policy, so you can come to us at any time in regards to anything. It could be something small about you having a bad day at work or something going on in your personal life. We're here to support you, and we want your time with us to be as positive and enjoyable as possible.
So I'd like to welcome you to what I think is a very friendly, although busy hospital. We have fun here, we practice very good medicine, and we'd like our standards to stay up, so we will welcome you into what is, I think, a thriving community of doctors trying to achieve the best for their patients. We hope your training with us will reflect that.